count 15 calendar days to submit the report to the FDA. So this is how you will be calculating from the day which was reported and the date of site awareness. And from there, you will count 15 calendar days, including weekends and holidays. And then you have to submit to the FDA. So FDA does not accept late reports for any reason. So you have to be very careful. Otherwise, you will land up in audits like how we were talking in the previous class. And there are certain responsibilities as investigator for IND reporting. So what the investigator has to do is he or she has to record all the adverse events, non-serious, serious, everything into their electronic case report forms. That is mandatory because see, I always tell this, it's all about data inside the clinical trials, right? So they have to have this data. That's when they will do a data analysis of all the reported adverse events. And from here is what they do something called the safety profile of the drug. So for that reason, everything should be recorded inside the ECRFs. So the investigator has the main responsibility of reporting all these events, and they have to report any serious adverse event immediately to the sponsor. That means like within 24 hours, it has to go to the sponsor. Otherwise, it's a big protocol deviation. So you don't want to kind of deal with that. That's why as a CRA, you have to make sure if you see any serious adverse event which is not reported to the sponsor immediately within 24 hours, then you have to raise a CAPA, which is the corrective and preventive action plan, and make sure you either warn them or you have to train them enough for them to report on a timely basis. You cannot have late reports for any reason. That is totally unacceptable inside the clinical trial environment because we are playing with human subjects. So anything which is serious has to be addressed immediately and cleared, because these are investigational products and you don't want to cause any kind of fatal events inside your clinical trial. So we have to be more vigilant in catching these things. And the investigator has to make sure it is getting reported. If it is not getting reported, then it's a bigger deviation problem that has to be notified to them, and they have to be trained enough to report immediately. And any kind of IND safety report, they have to submit to their IRBs. IRB should be notified of all the serious adverse events on a regular basis. As soon as it occurs, like there's a timeline for that, and that will be reported in your written in your standard operating procedures. Mostly like as soon as it is known, it should be reported within 15 days to the IRB. So they should be notified of all these serious adverse events. So investigator has to make sure it goes there. And as a CRA or a monitor, you have to make sure that the investigator works properly in doing all their responsibilities. There are two kinds of reports, like I said, expedited report and periodic reporting. Expedited report is the one which I talk for any fatal or life-threatening events. It goes in 7 days. For non-fatal serious events, for like hospitalization or any kind of important medical event, that goes within 15 days to the FDA. And there's something called periodic report. All these non-serious adverse events and serious adverse events which need not be reported to the FDA, all these will collectively go to FDA as something called a periodic reporting. This is an essential part. So for the whole year, they collect it and then submit it to the FDA. So the annual report usually is submitted within 60 days of the anniversary date that the IND application went into effect. So when you start the study, when you go through the protocol and everything, you will see that the IND has a birth date there. Like everyone has a birthday, like even your new investigational drug will have a birthday, and you have to calculate that day plus 60 days to submit the, like plus or minus, like no minus, like within 60 days of that birthday, you have to submit the whole annual report to the FDA. So this is called as DSER, which is the Development Safety Update Report. And for the post-marketed products, it's called the Periodic Safety Update Report. for the